More about the baby and how the baby died, if the baby possibly died of other causes and was also COVID positive?
Want to speak to that, either of you?
Yeah. Well, first off, cause of death is determined by the Office of the Chief Medical Examiner, and that is their task. Public health surveillance is very different. Our purpose is to try to identify people who test positive for COVID-19 so that we can implement control measures. So anyone who tests positive, contacts of that person need to be in quarantine. So our definition, what we're counting at the State Health Department, is different than what the medical examiner counts. I don't know the cause of death of this person that you're talking about, or any of the people, because we don't determine cause of death. We define laboratory confirmed COVID-19 associated deaths as anyone who has symptoms of COVID-19, test positive on a COVID-19 test before or around the time of death. We do not determine causality, but that is our determination for public health purposes. The medical examiner has a totally different job, which is to try to determine causality. And you really need to talk to him about the cause of death. And my understanding is, and having worked with all the medical examiners for the past 35 years, determining cause of death is not always easy and can sometimes take weeks to months.
Is it still accurate to link the death to the coronavirus?
Well, from a public health perspective, every COVID positive case that we hear about requires a public health action. So if someone dies and they test positive for COVID-19, for us in public health, that means we are still reaching out, identifying contacts. We do not, in any of our statistics, if you look at how we do flu surveillance, it's done the exact same way. You go to our website, you look at our weekly flu report, we list influenza-related deaths. This is how public health does this across the country. We do not try to, we have our role, we have our job, the medical examiner has his job, and they're very separate, and we count different things.
What we do know is that little baby tested positive,